In this interview, Michael Guthrie speaks with Nikki Edison, Chair of BAPO and Consultant Orthotist at the Royal Wolverhampton NHS Trust, about enhanced practice within her team and the vital role it plays in advancing the orthotics profession. Nikki shares insights into recognising and investing in orthotists working at this level, emphasising the importance of career development through apprenticeships, mentorship, and varied roles to support growth and sustain the workforce.
So I'm joined by Nikki Edison, who's Chair of BAPO, to talk about enhanced practice. Nikki, could you tell me about your day job and the service that you lead and manage?
Yeah, so I'm a consultant orthotist working at the Orthotic service at the Royal Wolverhampton NHS Trust. And my role encompasses all 4 pillars of practice. Part of my role includes associate professor position and my position as the Orthotic service manager. And as you just said, Michael, I'm also the chair of our professional body. So all of those roles are interlinked and include leading and overseeing development of strategic plans, local, regional and national policy. And the orthotic service I work in consists of 6 admin support staff, 7 orthotists, ranging from graduate orthotists, working at foundation level practice, enhanced level practice, and then up to my post, which is consultant practice. We also have 1 orthotic apprentice who started with us last year. And in terms of the size of our service and what we deliver around about 18,000 appointments per year. And we cover a range of complex orthotic clinics, including dedicated paediatrics with neurological conditions, specialist rehabilitation clinics for adults with brain injuries, specialist diabetes clinics, and clinics for adults with learning disabilities, and a whole range of other clinics as well. Our service also has a large inpatient service, so we cover a range of wards on a daily basis, and they include orthopaedics, oncology, stroke, trauma, care of the elderly. There are very few clinical pathways that orthotics isn't involved with in some capacity.
And so in enhanced practice, new language for many in the profession and many in the allied health professions more broadly. What does enhanced practice look like in your service?
I'd say the majority of our orthotists are working at enhanced level practice. Job titles include orthotist and senior orthotists. The pay range is usually an NHS Agenda for Change band 6 to band 7. And at this level, our orthotists are managing a level of complexity and usually leading complex clinics. And they often go down the route of having specialist expertise in particular conditions. So we'll have people in our team who will be the go-to to ask for a certain clinical complexity. And that's kind of what enhanced practice looks like us at our service at the moment.
And in your opinion, why is it important that we've got this language now? Why is it important that we're naming and recognising this part of the workforce?
I think it's vitally important because this group of professionals make up the largest part of the professional workforce. And I think it's important that their contribution to prosthetic and orthotic care is recognised. It's also important that their careers are varied and rewarding, and it's not just about moving away from those roles, because actually that's an important role in its own right, and not everybody wants to progress to advanced level practice or beyond. So I think getting recognition for those people and giving them a varied and rewarding career is absolutely essential to the profession, especially considering that we have the highest level of attrition for AHPs on the register for the first 4 years of practice. So where this level of practice is absolutely fundamental to keeping those people in the profession.
So as you know, a lot of effort's going on at the moment from NHS England around enhanced practice, and one of the ways in which they're doing that is there's now apprenticeship programs which are one developmental pathway for someone to be able to develop an enhanced level of practice. You probably touched on this already, Nikki, but if you're an employer, why should you think about investing in your enhanced practice workforce, whether that's through the apprenticeship or through some other kind of training or development route?
Because the work they do is essential. It's essential to the sustainability of your service. They're the backbone of the profession. As I mentioned earlier, P&O has the highest level of attrition amongst those entering the HCPC register for their first 4 years of practice. So it means it's essential that we invest in those professionals working at enhanced level practice, ensuring that there's support, ensuring that there's investment in the foundation stage, allowing competencies to be developed and teaching transferable skills as well as clinical competencies. So staff have the opportunity to take their careers down different routes, maybe still in that enhanced level practice arena, but they can still have a varied role. And by investing in that, you increase productivity, you reduce attrition, and you improve retention. So there's a lot in it for employers in terms of investing in this group of staff.
And if you're a P&O, perhaps you've just qualified, or perhaps you're in the first year of your first role within the workforce, what advice would you give to that person if you were, you were thinking about your next steps in your career and you were aspiring to moving into a role at advanced practice level? What kind of advice would you give that person?
I think the first bit of advice would be to speak to a line manager about what your organisation can offer you in terms of support and opportunities at this stage of your career. Continue learning new skills both within and outside of your workplace. Read BAPO's guides on preceptorship and foundation support, and also the guides on enhanced level practice. Ask a line manager what foundation support looks like in your organisation. If you're a BAPO member, seek mentorship through BAPO's mentoring programme. And also Salford University are currently developing an enhanced practice apprenticeship programme. So look out for that and when that comes available. And I have had I was the external examiner on that for that programme. I had a look at it and I was really, really impressed with what it contains. And I think there's a lot in there to offer people at the enhanced practice level, whether you're already working at that level or aspiring to go to that level.
So I guess the main message there is to be active in your own career development and have those conversations with your employer to see how they can support you to grow and develop.
I think so. I think there's two arms to it. So there's what can your employer do to support you, but also what can you do to take agency for your own career development as well.
Yeah, absolutely. Nikki, that was all the questions I had.
For more information on enhanced practice, kindly visit the BAPO website and check out the resource tab where you will find newly updated assets on advanced, enhanced, and consultant practice.